He's got the beard and wears glasses.
Hello, everybody. Hi, everybody. Welcome. If everyone could please take a seat, including you folks at the back, we can get more chairs out if we need them. But I would first like to just thank everybody for coming out in this miserable weather and coming to our healthcare rally, because it's really true that Band-Aids won't fix this mess that we're in for healthcare. So the first thing I would like to do is tell you that we actually have, in addition to our wonderful Lieutenant Governor, we have two representatives here with us in the audience. And I would like to just say that my personal opinion is that says a lot about their priorities and where their priorities stand. So I'd like for Alice Miller and Kaya Morris to please stand. Kaya's in the back over there. So thank you for joining us, and both of you have always been ardent supporters of healthcare as a human right. And what we're doing here today is we are trying to figure out how we can celebrate the anniversary of our own Vermont Act 48. And Act 48 is actually a law that was signed back in 2011 on this date that says that Vermont will have a universal healthcare system. And so in commemoration of that, and because we all know, who here either has suffered or has a friend or neighbor that has suffered from lack of health care? Raise your hands. It's a lot of hands, and it's probably most of the audience. So we're here today, and we want to say we need health care now. We need health care, not health insurance. Thank you. We need health care, not health insurance, and we are going to demand that we get it in accordance with Vermont's law, right? So before we continue any further, I just want to mention logistically, the restrooms are out that door and on your left. And feel free to get up in return. Feel free to cheer a lot. Or if you have a sign, and I did see one come in, feel free to raise that sign at any given time. So now what I'd like to do is talk about the sponsoring organizations today. And one of the organizations is RAD, Rights and Democracy of Vermont. And RAD's motto is, "Together we win." And that's true. We have to stay together if we win. And to that end, we are together with lots of really important partners in the healthcare field today. And one of them is the Bennington Free Clinic. And the Bennington Oral Health Coalition. And the Vermont Workers Center. And Planned Parenthood. And the Turning Point Recovery Center. Yes. And PNHP, Physicians for a National Health. Coincidentally, we also have the Progressive Party here with us today, and they are very supportive of healthcare as a human right, as we all know. So I would like to say that, first of all, do we all agree that we need health care now? Yes. So what is it that we need?
Health care!
Right, exactly. When do we need it?
Now!
What do we need?
Health care!
When do we need it?
Now!
Yes. And with that, I would like to welcome Dr. Dick Dundas, who is the Executive Director of the Bennington Free Clinic. And for anyone who doesn't know that about the Free Clinic, the Free Clinic was founded as a joint effort with the Bennington Interfaith, Greater Bennington Interfaith Services, and because of the fact that people literally are dying from lack of health care. And who knows that better than someone who has been a physician all his life, such as Dr. Dundas. Dr. Dundas practiced in Vermont for a long time. He actually went to Tufts School of Medicine. And he is also on the Board of Trustees of the Vermont Veterans Home. And that's another unique healthcare need that needs to be served. And of course, he also is affiliated with the Oral Health Coalition of Bennington. So we all know that Dr. Dundas has, throughout his illustrious career, seen a lot of human suffering. And perhaps that's when he retired, we'll put that in quotes, and formed the Bennington Free Clinic. So please give a really warm and heartfelt welcome to Dick Dundas.
Hello. Can you hear me? Yeah, good. I never can get these microphones the right direction. But Mary's right, I'm Dick Dundas, and I practiced here 43 years, and I retired from my traditional practice of internal medicine in 2008, and we decided to start the Bennington Free Clinic, which I founded in 2008, and then we opened our doors in 2009. So we take care of patients who have no health insurance. For various reasons they have no health insurance. It's been a lot of work to develop this organization. I've been helped by many, many other people. It's been a lot of volunteer time. It's volunteer based, and in spite of the work, we think we've done good work, and we've seen thousands of patients over these years that do not have health care, don't have any other access to care. So we try to provide it as best we can. So you might ask why we have a free clinic in the first place, and the reason for that is that our healthcare system is in shambles.
Yes.
Our healthcare system, as it exists, is sick, and it's a uniquely American illness. It's far too costly. I'll get into a little bit of the details later. It's dysfunctional in many spheres. Administratively, it's complex and chaotic. It's even dangerous to the population. So you have to realize that being the richest nation in the history of the world, that's not enough to guarantee good health care. You have to realize that having the best technology in the world is not enough to guarantee good health care. Having a very good hospital in our community and throughout our state isn't really enough to guarantee good health care. So there's something more that's needed, And you put all of these things together, and none of them work too effectively because of the system that they're practicing under, the hospitals, the doctors. Nothing works too well in our system. So I wanted to just look at the issues of two issues: the costs that we incur for our health care, and also the performance of our system. Our system, as some of you might know, spends $3.2 trillion a year. That's trillion with a T on healthcare. That's about 18% of our gross national product, which is much more than most of the industrialized countries. As a nation, we pay $9,000. Each one of us is paying $9,000 per year for our healthcare. $9,000. And other countries, citizens of other countries, pay about half of that. So you might ask what we're getting for our money. And to answer that question fairly simply, you have to look at outcomes, and the World Health Organization, which looks at things like longevity, infant mortality, other important issues, ranks us 37th in the world, 37th in the world for our healthcare system, our healthcare, what we deliver to our citizens. Think of that. There's 36 other nations in the world that have helped to deliver better care. The other thing is about our system is that our healthcare is inequitable. What does that mean? Well, to me it means we do not deliver healthcare well to low-income patients or patients of color. We have a saying at the clinic that that in America, living poor means dying early. So we have high cost and poor outcomes, and we should not tolerate such a system. The main problem with our system is that it does not offer universal care. And in addition to that, it's far too complex because of multiple payers. So those two things go together: universal care and a single payer would simplify things. And who do we have to blame for our system? Well, probably ourselves mainly. But I like to blame the insurance companies mainly.
Yes.
They rule the roost. They're driven by a profit motive. They do not care a bit about our nation's health. They try to select the healthiest patients to insure. If they don't make enough money in the area where they're selling insurance, they'll go somewhere else. They create huge administrative burdens to hospitals and physicians and other healthcare providers. They try to bribe our government with campaign contributions, and they're reasonably successful. But who pays for that? We, the people, pay for that.
Yeah.
The other industry that I like to blame is the drug companies.
Yes.
Medicines here in the United States cost 2 to 6 times more than in other countries. They're simply unaffordable for many. And how do the drug companies justify doing this in America? Well, they say that they need the money for drug research. But if you look at the statistics, the fact is that 84% of our new drug research is government funded, so they are not paying for new drug research. We, the people, are paying for new drug research, and they're reaping the profits. So it's estimated that we could save perhaps $600 billion a year if we had single payer and negotiated drug costs. 600 billion, that's a big amount, and it's a savings of almost 20% of our healthcare budget. We know now, we feel, I think almost everyone in the audience feels that healthcare is a human right.
Yes.
But our system is, is actually inhumane when you look at it. Here's an example. Before Obamacare, there were 49 million uninsured Americans, about 15% of our population. It's estimated that the lack of insurance resulted in about 40,000 deaths per year. These were people who died because of delayed care or no care because they could not afford health care. So with Obamacare, it's improved, but there are still 26 million uninsured. So the bottom line is that if we had universal health care funded through a government single payer, we would not only save money, but we would, more importantly, save a lot of lives.
Yes.
I think you get the picture of where I stand on these issues, and I have a little thing written here about Trump care, but I'm going to leave that to the next speaker.
Thank you so much. Thanks so much, Dr. Dundas. It's really, most of us are from Bennington, or at least the Bennington County area, and we all know people who are suffering for lack of health care, and I would point out even people who do have insurance but who can't use it because of deductibles and copays. And your organization has made all the difference in the world for them. Now I'd like to introduce someone that I'm privileged to call a dear friend, Vicki Lamprin, who is a member of Rights and Democracy leadership team, and who has been active locally. She's treasurer of our local Democratic Party. And Vicki has been very active in the last year. And I just want to relate that I was really impressed when I heard her speak at the Democratic State Convention. And she said, why did I decide to get active? For my granddaughters and their daughters. Because we all know that women need to get more active in our society. That was really moving. And most recently, she was at a People's Action conference in DC and spoke on the stage with our own esteemed Senator Sanders. By profession, Vicki is a home health care aide. And so Vicki sees the results of a system that certainly can't be fixed with a Band-Aid, and probably not with a lot of other things, on an everyday basis. And I really want to thank Vicki for coming tonight so that she can share her stories and thoughts with us. Vicki?
Wow, that was quite an introduction. I hope I can live up to that. So I am a proud t-shirt wearing member of Rights and Democracy. I'm so thankful to be a part of this group and to learn. I wanted to share a couple of things with you about healthcare and how it affects people. I have a friend who lives in Holland, and we were chatting the other day, and I said, Anne Marie, I want to talk to you about health insurance. And she said, oh, I don't think you want to. I said, why is that? And she said, well, I'm going to ask you, what do you pay every month for your health insurance? And I said, well, my husband and I pay $647 a month. And she said, oh. And I said, that's more than my mortgage, my property taxes, and my insurance every month. Mm-hmm. And then I said, yeah. She goes, now isn't there a deductible or something? And I said, yes. I said, there's a $5,000 deductible for each of us before our insurance pays. That's right. And then, after we meet $10,000, the insurance company pays 70%. Yeah. And she said, wow, I don't think I want to talk to you. And I said, Anne-Marie, I need to hear what it is that you and Holland have. And she said, well, My husband and I both work and we pay $202 American a month. Not only does it cover our health insurance, but it covers a multitude of things that are social things for people. There are groups of buildings that house senior citizens who can't afford to pay for housing, and that is part of what's paid for in her $202 a month. She said, we really, really believe that we have to take care of our most vulnerable.
Yes.
And she said, I can't believe that you live in the United States and you have such horrible health care coverage. She said, it's really a shame. And people who are in charge of that should be ashamed of themselves.
Yes. Yes, they.
And I said, Anne-Marie, tell me about, like, waiting 6 months to get an MRI or a year and a half to, have a mammogram. And she said, what are you talking about? She said, I found a little lump underneath my armpit about 6 inches down on my ribs. I didn't think anything of it. I let it go for 6 weeks and it got bigger. And she said, oh, I figured I needed to take care of that. So I went to my doctor. The next day, I was in a surgeon's office. The next day, she was in surgery. 2 weeks after that, she started radiation therapy. She's completely healthy. The cancer's gone.
Woo. Yay.
I get choked up about this because healthcare is such a huge issue. And to hear that there are other countries who can do it and do it right and take care of their folks. What the hell is wrong with us?
Yes.
I'm obviously passionate about this. As Mary said, I do healthcare, home healthcare. I have only one client, which, it took a long time to get to that point, but I'm very lucky. I take care of a young man who's 27 years old. I call him my third son, and he calls me Mammy, because that's what my granddaughters call me, is Mammy. And he is brilliant, smart, tender, caring. I walk in the morning and he says, so, what's new in politics, Vicki? And I say, don't you want breakfast? No, I want to know what's new. So it's a give and take there, but without Medicaid expansion, Darren would be in a nursing home. Darren wouldn't have one-on-one care. Darren wouldn't have the companionship that I can give him, the structure, the outside world that I can bring into him. Without that, he would just be another number. But because I can come into his home and take care of him, he's a human being that I can love, and who gives me love back. And I know that's not a popular thing to say in healthcare and blah, blah, but I don't care about that. That's not who I am. Darren needs to be bathed, fed, rolled. Darren can't lift his arms up. He can't move his toes. Everything that you do for yourself on a regular basis every day is what I do for Darren. I also want to let you know that I have his permission to use his name. I'm not breaking any HIPAA laws. Darren is learning about what would happen if we had universal health care. He's also learning about what will happen to him if Medicaid expansion is taken away. When he was in the nursing home, many of us have worked in that situation where you have 30 people to take care of in a day. You have 30 people to bathe. That's impossible to do. It takes me over an hour every day to bathe him. That's right. How can you do 30 people in an 8-hour shift? It just doesn't work. Darren has not had a pneumonia. He has not had pressure wounds. He has had no infections. He has been healthy and happy for almost a year now, living in his own home with his dad and his friend who visits him. So my point in telling stories is so that people can realize that we're human beings. We need to love each other. We need to take care of each other. We need to stand up for each other. We need to fight for what's right.
Yes.
We need to stand up in Montpelier and start screaming that we want universal health care in the state of Vermont. I also want to make it available to you that I'm happy to drive to Montpelier on any Thursday or Friday, so if you want to carpool with me, just make sure you know, I'll take you. So I want to thank you all for listening to me and listening to my stories and the human aspect of it, and thank you for all of your smiling faces tonight.
Wow, that was pretty moving, and I'm guessing that we all want for Darren to be able to have the kind of health care that we're here tonight to demand from the state of Vermont, which is universal health care. Am I right? So, in order to get universal health care, we have to band together. And if we're together, we can win it. So, how are we going to win?
Together.
And what are we going to do? Win it. Together, we win. Together, we win. Together, we win. Together, together, we win. Yes. Yes. Thank you. Oh, I just got this is a live Facebook feed. Thank you, Jeff Grimshaw. And he said that Darren just messaged and said that he's watching. Thank you, Darren. We love you. And now I'd like to introduce someone that I have just so much respect for. And he's the executive director of the Turning Point Recovery Center here in Bennington. And when we talk about healthcare, it frequently, sometimes we leave out of the equation that health doesn't mean just things that happen in a hospital, like our teeth are part of healthcare, right? Oral Health Coalition.
Yeah.
And that mental health and addiction are health issues that we need to treat because it is a human right for every person in our town, in our state, to have the resources available to be treated for addiction and for mental health. And Ken has worked tirelessly, both as a volunteer and now as the director at the Turning Point Recovery Center, and reaching out into the community. Ken is the chairman of the executive chairman of ACT, which Kaya Morris has been involved with, which is a program that attempts to make sure that our young people have resources to avoid getting the illness of addiction. Ken also works tirelessly with the whole Turning Point network in the state. He's been up at Montpelier a lot, trying to give input into the governor's task force on opioid addiction, because as we all know, this is an illness that here in Bennington has so many of us in its grips, even those that we may not know about. So I would like to introduce Ken Sigsbury, because I think that Ken can tell you a lot about the human suffering that goes along with lack of health care in those areas. Ken.
Okay, hi.
Hi.
All right, I'm kind of new to this. I just took over in January. I've only been doing this for 5 months, so I'm taking it a little slow. Basically, our executive director retired back in December, so the board approached me and asked me if I'd be willing to take it. I had volunteered there for 2 years at the Turning Point, and I was really surprised when they had asked me to take it, and I was really proud of myself. But one of the very first things that we do at Turning Point at the very beginning of the year, because we know our legislators are going to be going back to Montpelier, we have a legislative breakfast. So in being in tune with that, I invited all our legislators, we've got a couple in the room here, to come to Turning Point. We served them a nice breakfast and listened to what they had to say, and then they asked us what we were looking for, and basically I think they were expecting us to say money, but we didn't say money, because a big concern of mine personally is to get people into treatment very quickly. Basically because of the withdrawal symptoms associated with opiate addiction, by the third or fourth day of them abstaining, the withdrawal symptoms are so bad that if they can't get into some kind of a treatment, they will go back out and seek drugs again. So I did a little homework, and I basically told our legislators that what I wanted to was to decrease the amount of wait time it took to get into treatment.
Yes.
So a little history before that, Maple Leaf, which is a treatment center up north, closed down, which we lost 41 beds. And I was kind of upset about that, because usually if a hospital would close or something like that, there would be some type of plan B or action plan. There really wasn't anything, set up to cover what was going to happen by losing 41 beds. I mean, we had three treatment facilities, and Maple Leaf being one. So all we have left are Serenity House and Valley Vista. Now, if you include the retreat just mainly handles mental illness and detox from alcohol. They used to handle opiate detox, but they don't do that anymore. So our wonderful legislators went up north, and they cornered the governor, which was great. And, it was like 2 weeks later, I got a call from Barbara Samaglio, who's the Deputy Commissioner of Drug and Alcohol Programs, and told me that she'd like to come to Bennington and set up a meeting. So she told me that I could populate it however I wanted to, and she also told me that I could facilitate it. So it was like, okay. So it was a big setup for Barbara when she came. But it was good. I actually was the first time we have brought all of the inpatient and outpatient people around the same table. And I was only able to do that because I could use Barbara's name, because a lot of us get funding from this woman, Barbara Samaglio. And so when you mention Barbara's name, everybody says, yeah. So I used Barbara's name intentionally to get the people around the table, and we had a great meeting. We actually were able to accomplish in that meeting, we started talking about Valley Vista opening up a facility in Virginia, Vermont, that's eventually going to have 19 beds added to the roster of treatment, inpatient treatment. And then also Serenity House has converted one of their other halfway houses into a facility where they bus people down from Grace House to Serenity, that's Rutland to Wallingford, each day, and then buses them back. But the really good thing that happened was we got Phoenix House, that's in Manchester, New Hampshire, which is a treatment center. Phoenix House has a lot of facilities throughout our state, but they're mainly halfway houses, not treatment centers. But got them Medicaid approved, Vermont Medicaid approved. So I will tell you one thing. If you're passionate about what you're doing in your life, then we can accomplish anything. I've learned, and I go by this, it's a quote by Mark Twain, the two most important days of your life are the day you were born and the day you found out why. And I think a lot of this is our why today. That's why we're here.
Yes.
Okay? Thank you very much.
Thank you, Ken. That was great. And envision a world where what Ken was talking about wouldn't necessarily have to be so difficult, because if we had our own Act 48 implemented, it would cover mental health and substance abuse treatment. So can we do that? Yes. I'd like to introduce Rory Price next, and Rory is the coordinator for both the Kitchen Cupboard, which is our local food bank outlet, and also for the Oral Health Coalition. Rory sees a lot of aspects of healthcare that some of us might not be familiar with, because she sees both the nutritional part and the healthcare part, and how they intertwine, and how people can't eat apples without teeth, and all that good stuff. Rory was an AmeriCorps Vista volunteer at Southern Vermont Medical Center after she graduated from University of Michigan. And she moved to Bennington in 2015. After finishing up at Southern Vermont Medical Center, we were really lucky to have her become the coordinator of the Kitchen Cupboard and the Oral Health Coalition. Rory is also going to be pursuing a degree in social work and public health, which is just what we're talking about. All these things are public health. And will continue the good fight to eliminate the human suffering that we now have going on. So I'd like to welcome Rory to tell us more about oral health care.
All right, thank you, Barry. As she said, I'm Rory Price, the coordinator of the Oral Health Coalition, and I'm here to talk about oral health, which is really often neglected in conversations about health and healthcare. Dental insurance is viewed as this weird sort of supplemental luxury rather than a necessity, which it truly is. Around 44% of Vermonters don't have any type of dental coverage, and so we see a lot of people waiting until they have something really disastrous going on in their mouth before they go to the ER or to a dentist for treatment. But I'm sure, as you all know, dental health is an important part of general health and can impact the rest of the body's systems and the life of the individual. Links exist between gum disease and diabetes and heart disease, and many other issues that can really take a toll on a person. So here in Bennington, we see oral health issues impacting people at all age levels. Some of our elementary schools showed the highest rates of untreated decay in kindergartners and third graders in the whole state of Vermont.
Wow.
So even though we're lucky to have some really, truly great educators in our schools, if a child's mouth is painful, they won't be learning to their full potential, and they probably won't be eating or speaking properly. So through the Oral Health Coalition, we have seen children cutting their tongues on broken teeth, as well as infections that have progressed to an unsafe level. So this is a real problem right here in Bennington. While we as Vermonters are fortunate to have the Dr. Dinosaur program and world-class dentists working to address the need locally, access to care and affordability issues still do exist. The Oral Health Coalition has focused on prevention, so we aren't offering clinical services. We're in a free dental care program. To date, we have completed nearly 200 educational presentations in the schools, implemented daily in-school toothbrushing programs, helped to establish dental chairs in the middle and high school, distributed over 7,000 oral hygiene packages, and throughout everything promoted community water fluoridation as the most cost-effective, proven measure to prevent tooth decay in our citizens. In our adults, we see the impacts of oral health on financial stability, employability, and self-confidence. Through my position, I've interacted with dozens of adults who have opted to pay to have a tooth extracted rather than restored, and I have some of them on the table back there if you want to look. And then I've also unfortunately spoken with individuals who have pulled their own teeth with pliers at home rather than paid to go and see a dentist. As you can imagine, this would impact the individual's ability to eat fresh produce, to speak clearly, and really just creates a norm for the new generation that you will lose your teeth. So we don't want to see our kids thinking that they have to lose their teeth. One story that sticks with me, it's not a local story, but in 2011, a 24-year-old man in Cincinnati died from a tooth infection. He didn't have insurance and he didn't have a job, so he went to the ER for help. He was given a prescription for an antibiotic and for a painkiller. He didn't have enough money for both, so he bought the painkiller, which was cheaper. He died a few days later after the infection spread to his brain. So news stories stated that he chose to purchase the painkiller over the antibiotics, but I think we know that it wasn't a choice, and that our current system and the way that things are priced really doesn't allow people to make choices that will keep them healthy and alive. So to wrap it up, I'll say that this isn't the Wild West. People shouldn't be pulling their teeth with pliers or dying from tooth infections. This is the United States in 2017, and we all deserve better.
Yes.
So that I ask, as you talk to your friends and family and representatives about a universal health system, that you remember dental coverage, because any system without it truly wouldn't be comprehensive. So, thank you.
Yeah.
So it sounds like what everybody is saying is that our whole body is involved in healthcare. What do you think? And there are a lot of people in Vermont that have been working for a long time on healthcare as a human right. And we have legislators here in the room who have done it. And we also have a whole group of folks who are in the medical profession, who have for a long time been advocates of single-payer healthcare. And I remember back in 2008 or 9, hearing about the single-payer movement in Vermont. And one of the people that's always been instrumental in that is Dr. Marvin Malik. And his background includes a great deal of experience in community medicine. And also, he's in internal medicine, but I know that he also served as a consultation at the Vermont Psychiatric Hospital. So he's experienced all parts of what's considered health. And I know that he's somebody that knows that healthcare is a human right. Please welcome Dr. Marvin Malik.
Thank you, Mary.
Yes.
Before I start, I just want to say that the struggles, for those of you who have read the history of the struggle for universal health care in the United States, you know that it goes back a somewhat depressingly large number of decades. And back during the first and second and third round, particularly in 1950 and in several semi-close calls during the 1970s, the American Medical Association was staunchly opposed and really led the opposition to universal health care. And what I want to say to you about the organization I'm part of, Physicians for a National Health Program, is that without doing terribly effective self-promotion, our group now has 20,000 members. It's been growing especially steadily in the last 10 years.
Yes.
And I can tell you with confidence that if we succeed in developing a movement that's to be taken seriously for universal health care, the doctors will not be important opponents. I will eat my shirt if they are. I am not saying that there won't be large numbers of doctors who will oppose it. And regrettably, the small number of doctors who are in the U.S. House of Representatives are opponents, including the fellow who was from Atlanta who just got appointed Director of Health and Human Services.
Yeah.
That does not represent the medical profession any longer. We are now divided, and I am pretty sure that 35 or 40% of us right now would just say, yes, I'm a single-payer supporter. Only probably 15% or at most 20 are pretty ideologically opposed, and then a lot of the rest, don't pay that much attention and would not oppose it. So you will not see opposition from us, and it was Dick Dundas who told you where you're going to see it from. The wealthy interests, the pharmaceutical industry, and the
Yes.
insurance companies. They're the ones we have to take on, and it will be a death struggle for them, because it's not just, even though universal single-payer health care will put an end to the health insurance industry, the pharmaceutical industry spends just as much money in opposing this, because they know that if every additional dollar that goes for health care is coming out of tax money, that the federal national organizer of the National Health Fund, paying for everybody's health care, is not going to keep paying 50 or 80% more than all the other developed countries are paying for prescription drugs. It's got to stop.
Yeah.
It's got to stop. What I really wanted to talk about was a little more political analysis, and I'll really try to stay within 5 minutes.
Oh, that's
I don't know the first year it was that I saw Star Wars with my nephew. It could have been 25 years ago, I'm not sure. But,
A little longer.
but we may not have seen it when it first came out. But when I saw the character of Darth Vader, I did not think that he would be the one designing a national health plan. But now we've seen it. This was worse than Steve Bannon would come up with. This plan is astonishing. And poor Dave Zuckerman, who's involved in politics at the state level, this has not been publicized, but you have heard that the forces of darkness are going to allow 23 million people to go uninsured, and many millions more with such crap health insurance that it really will not be for them if they actually become ill. So that you've all heard. But what you haven't heard is that if that plan passes, there will be a crisis in every state government.
200 million.
Because they're taking away 25% of the funding for the Medicaid program. And when those people get sick, an ambulance is going to come and they're going to take them to a hospital, and those people cannot pay the amounts of money that in those bills that are going to come to their homes. And so either the state governments are going to really raise taxes to greatly expand their Medicaid programs.
That's easy to do, by the way. We do it all,
Yeah, really easy. Or the hospitals are going to end up with huge amounts of unpaid bills, and they'll cut services, they'll go bankrupt. I'm telling you, there will be massive crises. And I think the single worst thing about the press coverage we've seen is that they haven't talked about that. They've said, yeah, there'll be $119 billion over 10 years savings to the federal budget, but that is at the cost of state government. And the reason why, dollar for dollar, because there is no effective cost control in this Darth Vader care, or whatever you want to call it. There is no cost control. There's nothing there, and there's certainly no, or you could say there's cost control because people won't go to the hospital and they will die at home, and there will be deaths. There will be probably 23,000 or so extra deaths every year if this passes, and that is not difficult to predict. So that's what's coming our way, and there's a good chance that we're going to win a victory and that it won't go into effect. But the biggest reason I wanted to talk tonight is not about all that, because you already all know that, except maybe the part about the state budget data. But anyway, really what I wanted to talk about is the question of whether it is politically impossible. I've been rereading Paul Starr's book on basically the history of health reform in the United States, and he keeps using the term it's politically impossible for there to achieve health care. So I would like to talk a little bit tonight about the Trump voters. And I've got them divided into 5 groups. I think that there are, yes, he's done a lot of tacit permissiveness toward people who are bigots or anti-Semites or racists, anti-immigrant and all that. I get that. But I think that's out of all the 60 million people who voted for Trump, I don't think they're that high a percentage. Then there's the religious voters. There's probably more of them, people who are going to vote for anybody who say they'll ban abortion, and that may be more people, so that is what it is. But then 2 additional groups are the conservative ideologues, and they're the ones who are ideologically opposed to government, and they're highly motivated, and they run for political office, and they're overrepresented in the House of Representatives and the Congress, and in state legislatures probably too. Thank God, not in Vermont. Anyway, and then there's the wealthy. Not in the lieutenant governor's chair. And then the fourth group are the wealthy, the big money people, and they're funding it all. So really, Darth Vader care did not come from the first two groups, and sure didn't come from the fifth group I haven't mentioned yet. It came from the wealthy interests, the pharmaceutical companies, the drug companies, and the segments of the very ultra-rich who don't want anything progressive to happen, and they're funding the conservative ideologues that are taking the time to run for Congress. That's where Darth Vader care comes from. But it's the fifth group that I think is the solid majority of Trump voters. These are people maybe who don't follow politics that closely, but they do know two things. They figured out two things that I totally agree with them on. One is that the whole economic system since around the late 1970s has been stacked against the little guy. And they know that. Trump came and said, I'm already rich, I'm not out to get rich from being president. He said that to them, and they believed it, and they still believe it. And he said in Obamacare, and I will create jobs and make the economy wonderful. We can be great again, we can have jobs again. So do people on the political progressive end, on the left, in the Democratic Party, in the Progressive Party, believe that the economy is stacked against the little guy? Yes, we believe that.
Yes, sir.
So this is something we have in common with the majority of Trump voters. And the other thing that Trump repeatedly said was, Obamacare is terrible. Everybody will get health care if I'm president. He said that repeatedly. He said everybody would get health care if I'm president.
Liar.
His voters did not make him define that. And I believe that Trump is actually not very savvy in policy in almost any area. I don't think he was. So I don't think he knew anything, and he admitted recently that he's learning a lot. You know, people getting healthcare is complicated. So they were right. Do you know what a bronze plan is? 40% of the cost of your plan comes out of your pocket. Even in the platinum plans, the best one, you're paying 10%. Well, do you want to know what a hospitalization, say for a bypass operation or even a gallbladder removal? Thousands and thousands of dollars. And if you're paying 10% in the best plans, you're in real trouble. This is a huge amount of money. It's not good enough policy. It's just not good enough. And I hope that all of the people who believe in health care as a right or as something that is basic decency, for people not to have a mortgage foreclosure or a bankruptcy because they got sick. I hope that everyone will not stop when we defeat Darth Vader care, but we'll do more. So what I want to say is that I want to prove Paul Starr wrong.
Yes.
When he says that it's politically not possible.
Yes.
Yes, it's politically not possible with the current residents of those chairs in the U.S. Senate and the House of Representatives. But I feel that what Obama and Clinton, President Bill Clinton, never did, and too many of these politicians did not do, is to say to everybody very, very clearly, we are going to have universal health care. We are going to expand Medicare. There has never been a reason why we all pay into Medicare through our entire lives, and yet we wait till age 65 before we get benefits. There has never been a reason for that. We should be covered from the day we're born. And if you're wealthy, you want to pay for it too. And I'm in the top 10%. Not in the top 1%. I'm in the top 5 to 10. I'm in that group, being a doctor. And by the way, that does not make my tax bracket high because that's how ridiculous the tax system is in this country. Not in the low-income group. I do want to pay more in taxes.
Yeah.
But I have conditions for it. I have conditions for it. Number one, I want the people who are earning hundreds of thousands, who are ending up with hundreds of thousands of dollars in pay, because once you're much beyond 150,000, I don't know how much you're earning anymore. Are you really working harder than somebody who's doing home health care? I doubt it. So, but anyway, these people, all I'm saying is that the people who are earning a lot more than me, I want them to pay more. That's number one. Number two, I don't want all the tax money I will be paying to go to ridiculous insurance companies, which is what Obamacare is doing.
Yes.
Taking your tax money, saying, oh, won't you provide health insurance to all these people? Here's all this money, huge quantity of taxpayer money going to these insurance companies. It ought to go to health care.
Yeah.
And I'll pay gladly. That's it. And I want to pay because I know that there are people on the street I live on who I want them to get health care if they get sick. I want them to get health care. I don't want them to end up bankrupt. I don't want cancer to be a prescription for bankruptcy. That's indecent. I want to live in a country where we have a healthcare system that promotes basic decency. It'll cover me when I'm sick. It'll cover you when you're ill. That's basic decency. It's social solidarity. That's the kind of society I want to live in. And if the politicians say that at the presidential level and at all levels, we will have the political coalition we need, and we will win this battle, I promise you. But I need people in the political sector to say that. That's what we need.
Yes.
We can do this.
Thank you. Thank you so much, Dr. Malik. I really am moved by that because this is a perfect segue into our next speaker, who is Kate Cannelstein, who is the director of the Vermont Workers Center. And the Vermont Workers Center started a Healthcare as a Human Right campaign many years ago, which actually resulted in the signing of the act that we're celebrating the anniversary of today. And at that time, Kate will tell you that people said this isn't politically possible, that you can get that act passed. But Kate was able to marshal enough people to give voice to their feelings and feel confident in doing so, to actually tip the balance of power and make that possible. So I would like to introduce Kate Cannelstein, who personally has been an inspiration to me ever since I've been working on healthcare as a human right many years ago in 2007 or 8 or something, and who really knows about, and I was going to give you some more facts in terms of her background, but the really important thing is that she knows how people suffer for lack of health care, and she's able to inspire each of us to stand up and identify our suffering and support others who suffer. Kate?
How's everyone doing right now? Okay, good. This is a lot tonight. It's a lot to think about, a lot to feel. Can you hear me okay? I'm a little shorter than everyone else, especially Dr. Mack. Cool. So yes, as Mary said, I am the director of the Vermont Workers Center. We are a statewide grassroots organization of low-income and working people in Vermont building a movement for human rights. And why are we here today?
Healthcare.
For healthcare. We're here because Band-Aids are not going to fix this mess.
Yes.
We're here because the healthcare news coming from Washington is worse and getting worser.
Yes. Yes.
We're especially for women and
Oh,
people with
yeah.
disabilities and foreign working people in general. We're here because insurance rates are rising year after year. Did anyone hear Blue Cross Blue Shield just requested almost 13% of an
Yeah.
increase this year from the Green Mountain Care Board? And because we know that politicians who have a stake in the status quo are using healthcare as an issue to wedge our communities, to divide us.
Yes.
For example, public sector workers like our teachers and the rest of our communities. Anyone hear anything about that lately?
Yeah.
And most importantly, because we are all here grounded in a moral vision that healthcare is a human right.
Yes.
Our shared humanity. In 2010, we had a saying, Vermont can lead the way on healthcare. Did anyone remember hearing that?
Yes.
Yeah. Right now, that's happening. People across the country are building statewide campaigns like the Healthcare is a Human Right campaign in Vermont for universal health care. You're seeing those kinds of efforts in California, in New York. They've been getting a lot of press, but also in Maine and Pennsylvania. And here in Vermont, we actually have a law in the books, as we've been talking about, that commits our state to treating healthcare as a public good. And Dr. Malik really spoke to this. I really believe that finishing the work of designing and implementing our universal health care law in Vermont isn't just necessary for our communities, but it's also the most effective resistance that we can offer to the current administration in Washington. In the context of an increasingly transparent divide and conquer politics, healthcare is an issue that can unite people across race, gender, age, ability, region, even political affiliation, because it's a fundamental human need. Anyone think that's going to be easy to do? No. Probably not. Changing what's politically possible and fulfilling the promise of Act 48 boils down to a question of power, right?
Yep.
Yeah.
Here's an anecdote. Who remembers in 2014 when former Governor Shumlin said that implementing Green Mountain Care would be too much of an economic shock to the state? Anyone remember when he said that?
Oh, yeah.
Okay. The governor's own financing plan showed that 9 out of 10 Vermont families would see higher net incomes. They would be paying less, essentially, if Green Mountain Care was implemented. 9 out of 10. That's because under Green Mountain Care, we would pay for health care together through progressive taxes, what Marvin was just talking about, which means that low and middle income people would pay less and the wealthiest in our state would contribute their fair share. So what the governor was really saying was, I'm not willing to raise taxes on the wealthiest people in Vermont.
Right.
And it's not just Governor Shumlin. This has been an unspoken rule in Vermont politics going back decades. You don't raise taxes on the wealthy or the biggest businesses.
They'll move
in
out of the state.
Yeah.
Right.
So there's an important lesson here for us, for those of us who are committed to implementing Act 48. We have no chance of winning universal health care if we don't change the balance of power in our state through building strong organizations of working class and poor people from every corner of the state, those of us who have been left behind by politics as usual, that can go up against the power of the economic elite.
Yes.
We need to be clear that what we are fighting for is not just universal health care.
Right.
It's for a real democracy, where we, low-income and working people's needs and opinions are as important as the folks rolling in country clubs and private ski resorts. That's not going to be an easy task, but that's why taking on the issue of healthcare is so important for us in this political moment, where we're dealing with a serious erosion of democracy in the midst of a growing environmental and human rights crisis.
Yes.
So, what are we gonna do? What's next on the road to healthcare as a human right? From the point of the view of the workers from the point of view of the Worker Center, it's an organizing challenge, fundamentally. There are thousands of us, people across the state, who are super worried about losing their health care, but have never been invited to join an organization like the ones in the room today. And we need to connect with those people. On our end, we'll be out all summer at county fairs, holding health screening clinics in partnerships with nurses all over the state. Speaking of where the healthcare money doesn't go in our healthcare system, nurses, LNAs, home healthcare providers, right? But it can look like a variety of things in different places. On July 20th, we're going to be mobilizing to the Green Mountain Care Board hearing in Montpelier to talk about how we do not want to see Blue Cross Blue Shield get a 13% raise this year. None of us are getting that. And furthermore, we do not want to see this healthcare system continue to be run as a for-profit system. I think am I right that there's going to be a group from Bennington
Yes,
carpooling
yes.
up to the Green Mountain? And we're going to be looking ahead to the fall to be putting on some public forums, calling on the legislature and the governor to start off the 2018 legislative session by talking about how they're going to fully implement and fund universal health care for Vermont. One simple thing you can do tonight, and that's sign one of these petitions. And I think Ellen and maybe Spoon and Michael have some around that they'll pass around to you. But you can sign them and give them back to us before we go, and even take them with you to get them filled out. They basically say what I said. We're calling on the governor and legislature to implement Act 48. And so to wrap up, it's lovely. It's really lovely to see everybody here tonight. I just want to zoom out for a minute, though, and emphasize again that this is going to be a big political lift. This is going to be work. It's not just a question of projecting a powerful moral vision, but it hinges on really coming together as people impacted by this problem to challenge the power of those at the top. And that's a question of getting organized. It's a question of building a movement that adds up to more of the sum of its parts. It's a question of us really putting that, working together to work. I also want to emphasize that by fighting to guarantee healthcare as a human right and public good, we're going to have to go on the offense and challenging the system as a whole, a system that really aims to privatize everything for sale on the market and put our lives and our humanity last. And I just want to reiterate as well that in a context where our communities are increasingly fractured, universal health care, I believe, is a way for us to start to repair those human relationships. Right. It's a way for us to actually get out into our communities, talk with our neighbors, empathize with each other, hear each other's stories, with other living, breathing human beings who are our neighbors. And in these times, I think that's a very crucial act. So, thank you.
Thank
Who already spoke. You are incredibly inspiring, and your work is incredibly important. And thank you to all of you.
Thank you.
Thank you so much, Kate. And as Kate said, we need to come together to win healthcare. Are we going to come together?
Yes!
Are we going to get our friends and neighbors to come together?
Yes!
Okay. And we do have in the room two legislators who, and Alice, I know, was one of the people that voted in favor of Act 48 when it was being passed, and actually our current lieutenant governor was at that time in the legislature as opposed to being lieutenant governor, and he also was a big supporter of Act 48. So I'm sure they'll support it again, and we're here to support them to do that, right? So I would love to next, it's really my honor and privilege to introduce David Zuckerman from Chittenden County. He is actually the co-owner and operator of an organic farm with his spouse, Rachel Nevitt. And it is a CSA and sells at local farmers markets. And he also has been a tireless advocate for universal health care from the time that the Healthcare as a Human Right first started as a campaign. Our Lieutenant Governor has been our supporter. He has been a representative from Chittenden County and a senator from Chittenden County. And thank heavens he is now our 81st Lieutenant Governor of the state of Vermont, David Zuckerman.
All the speakers, Dick, Vicky, Ken, Rory, Marvin, Dr. Malik, Kate, can I get everybody? Hope so. For putting this together, for being here, for driving from near and far, to continue this discussion about how we're going to get to the sane, decent, common decency, moral value idea of universal health care. Thank you so much for coming. And I want to really, I know they've been mentioned, but Representative Kai Morris and Representative Alice Miller really deserve a round of applause, and I'll tell you why before I ask you to applaud. One thing people don't really realize about so many of your legislators is that they attend this meeting, and they attend another meeting that you're not at about another issue, and another meeting another evening. Kaya's brought her family. You know, it is a lot of work to be a part-time legislator who has to take time away from their jobs to work in the legislature for what is really not a lot of money. One of my farm workers once said, yeah, but you get great health insurance and you make $160,000 or something. And I said, that's U.S. Congress, not the Vermont legislators. So with the information of the reality of how hard they work, they take 4 days away from this community every week to go up to Montpelier, live away from their home and families. So please give them an applause for their incredible hard work. And they have to go back in a couple more weeks, as I do. But so, you know, we have to think about this issue in a holistic way. You know, we think about healthcare, and we ought to be thinking about it holistically, the food we eat, the cleanliness of our water, which around here is obviously a pretty important issue these days. You know, the exercise that we do or don't get, our bodies, this one vessel that we have, for whatever number of years we get to have it, from the day we're born till the day we figure out why, and beyond. This is all we've got. And we have to be thinking about it from physical health, dental health, and we talked briefly about mental health as well. And you know, this year in the legislature, with leadership of these two and many others, we found resources to add to the pay of our very low-paid mental health frontline workers,
Yes.
to work them up to all of $14 an hour. It was less than that. But these are critical steps that need to be taken for consistent care, quality care, and the things that actually in the long run are very valuable to those folks out there that are quite conservative, which is actually, if you have quality care and consistent care, you have actually less expensive care. The system is far less expensive when we actually treat people early, treat people well, and take care of them so that chronic illnesses don't get to extreme levels. All of these things are the things that are being threatened to be stripped away by Darth Vader care. Thank you for that term. The statistic is true. The original plan that was going to kick 24 million people off, this one's a lot better, it's only going to kick 23 million people off, was estimated to cost Vermont and Vermonters about $200 million in expanded Medicaid. That is because it's being live streamed, I won't use the word I was going to use. I'll just say a boatload instead of another of money on the scale of Vermont. And it is very serious. I brought this up to read something, I won't read it, but I had someone message me on Facebook and said, you know, is this really going to happen? Because I just lost X dollars in my food stamps benefit because I got $3 more in a different benefit. And I did direct him towards Senator Leahy and Senator Sanders and Congressman Welch to understand what the impact would or wouldn't be for his SSI. You know, this is affecting people, 1 by 1, 10 by 10, 10,000 by 10,000, just in little old Vermont. And it is frightening. Now, what I see in this room and in newscasts and Facebook live feeds and others from around the country is there are rooms like this packed with people, thankfully, particularly in some of those districts that those representatives, those highly paid for ideologues by the wealthy who are serving in Congress, that people are coming out. People are rising up. And to echo what Kate was talking about in terms of organizing and participating, the groups in this room are the folks that are going to help feed you the information on when and where and how to rise up. Now, who here went to Montpelier or traveled south to DC on January 21st? Raise your hand. That was a powerful day. It was a powerful day for me as someone who on November 8th or whatever the day was that I got elected was supposed to be pretty excited and was pretty darn bummed out, as were plenty of other people around this state and around the country. That day said, we are not alone. The weight of this burden is dispersed upon millions and millions of shoulders. And if we each rise up and do our part in what we can do on a weekly basis or a monthly basis for just 15 minutes, or maybe an hour a week, depending on what your time flexibility is, we will have an incredibly powerful voice in this system that is supposed to be called democracy, and that the voices that we have are supposed to be the voices that actually make the policy happen, not the 1 or 3% that are currently dominating our political system. So my question for you is, do you have 15 minutes a week or half an hour a week to make these changes happen? Right? And we make it bite-sized, because if we say, you got to spend 20 hours the next 3 weeks, the burden is too great. But if you spend 15 minutes or an hour, it might be making a phone call to your representative, senator, or to the governor, 828-3333. It might be going online and reading news accounts or stories and liking good comments or not liking comments that you don't agree with. It might mean writing a comment or a letter to the editor. But if everyone in this room does that for 15 minutes or an hour a week, those unlike numbers will go in our favor. When you call your legislators, you need to know that on many, many issues, when I was a legislator, half the issues you don't get a single phone call on. Another 35% of the phone bills you might get 2 or 3 calls on because someone in your district really cares about that issue, so you get a call from them. And it's really only a handful of issues that people get 5, 10, maybe 20 calls if a couple of big groups really put out the call to arms and call your legislator. Which means that the people in this room, how many people here have called your legislator on an issue? Good. This is an active crowd. I kind of expected that. But those calls can make a difference, especially if maybe your 15 minutes a week or hour a week is starting to build your own little network of 3 or 5 friends to say, hey, if you care about these things, if I gave you a call or an email, would you pick up the phone and call your legislator or the governor's office? These two, they're pretty good. You don't have to call them quite as often. It'd be good to call them and say, hey, I got your back. It's nice to know that your constituents have your back. But it's also good if you've got limited calls, call them once in a while. Call Bernie once in a while and say, you're doing the right thing. Keep it up. But call the governor's office.
Yes.
Call the governor's office and let him know that Vermont should lead the way on health care reform.
Yes.
Vermont should lead the way on mental health support. Vermont should lead the way on drug policy reform. Vermont should lead the way on environmental justice reform. Vermont should lead the way on criminal justice reform. We have the opportunity when people like you in this room come together to make it happen. And it's happening all across the state. People are gathering in rooms like this saying, what are we going to do to make this the common decency society that Dr. Malik was talking about? People are rising up. That's the silver lining of the Darth Vader cloud, is people are realizing that democracy is a participation system. We can't just vote every 2 years or 4 years and sit back and let it happen. You've got to continue to participate. If you can find half an hour, 2 or 3 days a week to jog, or to go to a book club, or a movie night with a bunch of friends, then you can find 20 minutes or half an hour for democracy.
Yes.
Right? I'm going to wrap up with just a couple of quick things. You know, when we don't deal with drug addiction as a health issue,
Right.
and we deal with it as a criminal justice issue or criminal injustice issue, we're spending $60,000 a year of your tax dollars to put a male in jail. We're spending almost $80,000 a year to put a female in jail. It is not conservative thinking to spend that kind of money when there are far less expensive alternatives through drug treatment facilities, drug treatment programs, and getting people back on their feet and into productive members of society.
Yes.
That is liberal and conservative thinking coming together,
Yes.
right? If we took that money, we could lower taxes, or we could fund higher education like our state colleges so that people would have something when they're in 6th, 7th, and 8th grade to aspire to, instead of going, I don't have a future, I don't have a hope. And the way I see someone making money is by dealing drugs, for instance.
Yeah, yeah.
Give them another system of hope that isn't that path with all of our resources, and we will all be better off.
Yes.
And we will reduce the disproportionate incarceration rates of our people of color in our community. And we will empower people to have a future that is not a very small room with not other people. And frankly, we use our jails now as mental health holding facilities. Again, more expensive than it needs to be. This money can be in our healthcare system. This money can be in our clean water. This money can be in our education system. This money can be back in our pockets if we start thinking holistically about how all these things are related. And I just want to mention the Planned Parenthood table is here. I stand with Planned Parenthood.
Yes.
Key organizations for primary health care in our country.
Yes.
They have been sadly and viciously maligned
Yes.
by the right-wing ideologues around one piece, which is only about 3% of what they do.
Yeah. Yeah.
One piece of the health care they provide. The rest of what they provide is primary care, which is the best bang for the buck when it comes to health care. Nothing against internal medicine, it's pretty important too. So, I thank you for the opportunity to speak.
Yay.
I thank you for your support for universal health care. I thank you for your thinking in a big way about how all these things are interrelated and how we as a state can lead the nation on so many of these issues. So thank you for coming out.
Yes.
Thank you, Mary, for organizing. Thank you, Mary.
Yes, please.
Sorry, you can stay here.
Okay.
So part of organizing is with these groups, but I also want to let you know that my office, the Lieutenant Governor's office, puts out a newsletter. Who gets my legislative update? Okay, so a lot of you don't yet. But if you want either email, or if you don't have email, you can give us your address. It goes out every couple of weeks to 3 weeks, sometimes a month during the session. I have a chief of staff of 1. Meg, are you here? Can you raise your hand?
Hey, Meg.
Where are you? Meg makes it all happen for me, and she enters all that data. She writes the newsletter and helps get it all done. But it has always how to reach your legislator, how to reach the governor, how to reach me, and usually 2 or 3 issues. And we're building this list all across the state with people like you. So if you want the newsletter and you want to use your 15 minutes to call on some of those issues, please make sure to sign up on our clipboard, which I think is in the back of the room.
Yes.
Thank you.
Thank you for adding that. And so, are we going to rise up on healthcare? And what do we want? Healthcare. When do we want it? Now. What do we want? Healthcare. When do we want it? Now. And are these Band-Aids going to fix this mess? No. So, there are pens back there, and as you walk out, I'm going to ask that you put an X on your Band-Aid to show that it's not effective at fixing this mess. And also, don't forget to pick up our call to action for healthcare, which actually gives you the emails and phone numbers of all of our local legislators, as well as an email address for the governor to tell him that we're demanding health care. So please pick this up on the way. Thank you for coming. Thank you to all of our speakers for the wonderful information and inspiration.
Adrian, you're here down here in Bennington with Rights and Democracy. What you been up to the last couple days?
We've been knocking down doors, talking to folks about the work that we're doing, whether it's on clean water, healthcare, economic justice, and also inviting people to come out to the healthcare rally that we're having today.
So tell me a little bit about Rights and Democracy. What do you guys do?
Yeah, we are a nonprofit grassroots organization. We work all over the state on a variety of different issues, and really trying to bring folks into the political process, getting involved and talking with their legislators, working in their communities to fight for to build up a better democracy and fight for individuals' rights.
You seem excited about your work. What do you find most fulfilling about it, nonprofit work?
Yeah, I think that there's a lot that we can be upset about right now in the political sphere when we look to the national scale, and honestly, here on the state level as well. Politicians just not trying to get a lot of stuff done, and so I think that what I find most exciting is that we have people that are coming out and getting involved and demanding that we fight back and build something better. Resisting what the Trump administration is pushing down from up top, and fighting for a better future as well.
A lot of the issues too, though, are nonpartisan, especially when we're talking about like clean water here in Bennington. Talking about leads into the pipes, our deteriorating waste treatment plant that we really need to have infrastructure repair on. So what's your experience been like here in Bennington?
Overwhelming support. We're focusing a lot with the canvas on the clean water issue, and I haven't really met people that don't think that we should be fighting for clean water. Everybody needs water to live, and I think that most people agree and want to support that.
So to get involved now, what would you suggest a person do?
Come out to one of our action meetings. That's absolutely the best way. We meet on the first and third Wednesday of every month at the St. Peter's Church. So come out and get involved there. And you can also sign up as a member. We can't match these big corporations that we're fighting dollar for dollar, but we can out-organize them and get more people on board and fighting for these issues. So signing up as a member and coming out to the action meetings is by far the best way to support.
Is there a website if I have a problem getting out?
Absolutely. radvt.org, which is the acronym for Rights and Democracy Vermont.
Thank you very much, Adrian. You have a good day.
Thank you, you too.